Hello, welcome to the Ali Houston Transforms podcast. I'm a former physicist who fixed my brain using nutrition. I now coach people to empower them to do the same. If you or anyone you know could benefit from a mental health tune-up, head over to metsy.com, METPSY, where myself and psychiatrist Dr. Rachel Brown coach people to better mental health. And I'm delighted to have with me today Olivia Khwaja and Sam Feltham. Welcome to both of you.
Hi.
Thank you. Thanks for having us.
Olivia, can you tell us a bit about yourself and how you came to be a board trustee at the Public Health Collaboration?
Yeah, absolutely. So, hi, my name's Olivia Khwaja, and I have not been from a nutritional background for the most part of my life and career. I very much started off in the business world and had about 23 years of working in a corporate environment for probably the two most recognizable brands in the UK, and very much in a kind of strategy marketing role, and was pretty happy generally for the most part. But it did get to a point from a personal point of view where it was taking a bit of a toll on my health and my personal life, and I also encountered my parents passing away. So I decided to take some time out and to have a bit more, take a step back, have a bit more perspective on life, and see if there's anything else out there for me. So I took a little break about 3 years ago and decided to work through some of the things you never get time to do when you're in a career with full-time kids as well, and decided to research the optimal diet and what that was, because I was very conscious that my parents had passed away from diabetes and also Alzheimer's in the case of my dad. And it always felt like, oh, I'm done for. I'm going to have these diseases. And having cared for them for 10 years, that was quite a harrowing experience, and one that I didn't want to go through myself, or nor did I want to put my kids through that. So it felt like I could at least make the effort to reduce that inevitable consequence that felt like it was coming my way. And lo and behold, when I started doing this type of research, I found that, very quickly I'd gone from Google straight into many research papers, and found that there was plenty of evidence to suggest that none of these diseases needed to happen, which was quite a revelation for someone who'd, been on the front line caring for my parents for 10 years and had to, look my dad in the eye when he was trying to reckon with how he was going to be losing his memory, which was an awful thing to watch and witness somebody having to go through. And it left me quite frustrated that there's such a lack of information about something so fundamental and basic as how we should be eating. Probably what affects our quality of life the most felt like the information that was lacking the most as well. And coming from a background of strategy and marketing, it felt like I'd rather use my skills in this space for a little bit and see if I can help in some way. So the Public Health Collaboration was at the time just advertising for trustees, and I applied and found that that was an opportunity I was offered. I was really pleased to find that, and yeah, so since then I've been working on that and going on my own, continuing my own personal nutrition journey as well.
Fantastic. Yeah, sad story. Thanks for sharing. Sorry you had to go through that. My gran had Alzheimer's and it's dreadful. And I shared that feeling of kind of disbelief that there wasn't really much in the way of education for doctors, nor for the general public, in terms of how much diet and lifestyle can influence these things, and how pockets of researchers were starting to call Alzheimer's type 3 diabetes, and how they were linking it to other metabolic illnesses and so on, and how red meat had been unfairly demonized, etc., etc.
Yeah.
It kind of, for me, I felt angry, relieved that I'd found good information, relieved that I felt good, and that hopefully that I was, having one copy of the APOE4 gene, leaving me at higher risk to Alzheimer's. I was relieved that I could take control to some extent. And I guess that's something that Sam, you found with your background kind of empowering people to take control themselves. Is that right?
Yeah, that's probably a good way to put it. So my background before the public health collaboration was being a personal trainer and fitness boot camp instructor. So 2010, I trained at the European Institute of Fitness as a master personal trainer, and then kind of got out into the big bad world, and trying to help people become healthier through exercise. But quite quickly, you realize how important nutrition is. Thankfully at the time, Gary Torbs actually published his How We Get Fat book, which is kind of like the brief version of Good Calories, Bad Calories, basically. So that was really good, and a good inception into what was to come. And I just started recommending clients low carb diets, along with kind of the interval training and strength training that we were doing at the boot camps. And that was just, it works really effectively for people. But it's not just, advising that and then it just happens and they stay in that happy place forever. It's a continual battle, and trying to help empower people and support them for as long as I can has kind of always been a purpose of mine since 2010.
Very cool. Yeah, you find people, that saying, when the student's ready, the teacher appears kind of thing. There's a cycle of change where people are, nowhere near wanting to change. Maybe they're in denial about their own behavior, about what's really harming them. And it's almost, there's almost very little point in trying to reach people who are there. It's people who are kind of thinking about it. And so a lot of people, even who listen to the podcast, will have started eating stuff that they don't want to eat for their health goals. They'll be thinking, how do I kind of reset and push ahead again? And we all fall off the wagon once in a while, some more than others, myself included. And I know that food addiction is a component of what the public health collaboration does. Certainly, Jen Unwin's talking at the upcoming conference about that side of things, and I dare say other people will too. But this is what we really want to talk about today, is the conference that's coming up. You were talking about all of this kind of stemming from around your reading around 2010. Even then, there was stuff from Atkins way back, and then more historical figures like Banting and people who'd written about low carb diets for the last however many 100 years. And then the sort of paleo anthropological approach, where you can look back thousands or millions of years and find evidence. But there's really, really high quality stuff from, the early 21st century, the latter part of the 20th century, that most people don't even really know about. People like Finney and Volek, the art and science of low carbohydrate performance, and various others. And I guess like part of what you're trying to do with the conference that's coming up on the 19th and 20th of May in Sheffield in England is showing that there's really high quality science being done around all this. And, you've got people like Ben Bickman, David and Jen Unwin, Professor Roy Taylor, Sophia Clemens, Sean Baker, Anthony Chafee. The list goes on and on. So can you talk more about the conference this year and what you're aiming for with it? Please, Olivia, go for it.
Sure. I mean, from my perspective, and just to, I guess, reiterate my background being in marketing, I've always looked at how we get the message out to the public and how we educate at a population level. And just to pick up on your point earlier, Ali, about, some people are not ready yet. That is a very classic aspect of how you communicate a message. You take into account the adoption curve, the natural cycle that a population will go through, because you'll have those early adopters that are there right now and benefiting, and then there will be an early majority, or you'll have your innovators, then your early adopters, then your early majority. And to my mind, the quicker we can get up that curve, and the quicker we can make the curve look like that rather than long and flat, the quicker we will benefit more people and reduce suffering, reduce costs for the NHS. So bearing in mind that we're really just trying to get the message out, absolutely, to the medical healthcare community, but maybe more so than we have before to the public. That is why we have designed it in such a way where it's at a venue where you're able to come along. There's plenty of space, and speakers that we hope, at least those that are interested in health already, will recognize some of the speakers. And as you say, they're very much backed by science, and they very much have followings themselves and already making impacts on people's lives. And bringing those types of speakers together into a venue and asking the public to come along, we think is hopefully going to explain that across many, many different metabolic illnesses, you have the same root cause that is underlying all of it, which is that your metabolic health has not been fully cared for, fully understood, and you're not, and you don't realize yet that you have the power to do that. And so with all of the conversation around the NHS and the issues with the NHS and how we fund more services in the NHS, we think it's really important to use the conference as a platform to slightly adjust that narrative, to say, let's all look at our own health and let's change things for the better, whether we're the public, whether we're from the healthcare community that is helping the public. And so it's been designed that way to really start making inroads into that adoption curve and getting more people along to the front.
Yeah. Sam, I last saw you in Solihull at the Primary Care Lifestyle Conference, where it was really aimed at primary care healthcare workers. And that was really interesting, because you could tell from talking to them that there was loads of people who were on the fence who were there. And I dare say it'll be the same with the Public Health Collaboration Conference, where people are coming along curious but skeptical. Do you have a sense for, the kind of breakdown of people who are going to be there?
Yeah, I think it will kind of be as it has been for kind of like the past 7 years. This will be our 7th annual conference, so it's incredible that we're getting so big now. But it's probably going to be about 50% healthcare professionals, 50% passionate members of the public. But in terms of kind of like people's levels of skepticism, I don't know. But having spoken to some people, I know that they've managed to kind of, convince some colleagues that aren't necessarily so into this to come along to the conference. And kind of, you said curious but skeptical is probably a good phrase for it. But that's kind of like a good place to be, isn't it? That you're completely open to listening, but you're not afraid of asking questions. And that's what the PHC is all about, basically. We're absolutely open to listening, but we're not afraid about asking difficult questions.
And I think both those audiences have a role with each other. So I think the more you get the public along, the more they're going to educate their own doctors. And you just listen to David Unwin's story. That's exactly how it happened. So it's a cyclical effect of both those audience, having that knock-on effect on each other. So we want everyone there.
Exactly. And collaboration is the name of the game.
Exactly.
It's patients and healthcare professionals working together to create a healthier and happier society. So
yeah, they can all talk to each other. And I think access to healthcare professionals who understand what you've gone through and what you want, which is, remission of so-called chronic illnesses and prevention of so-called inevitable illnesses, and being able to speak in person to world-leading experts on this is kind of new, I think, in the UK. It doesn't happen very often anyway. On a personal level, Sam, who are you looking forward to seeing talk who maybe it's been you've been following for a long time?
Who's my favourite? I hate to.
How are you going to
say
choose
favourites, but yeah, this is it. I mean, Olivia and I have kind of like cultivated the lineup, so they're almost all our children. But I think the best way to put it is maybe kind of like by panels, because we've for the most part the conference is made up of panels of multiple speakers, because we think that's like it's a more exciting thing to see, isn't it? Like actual experts in a discussion together talking about stuff, rather than just kind of death by PowerPoint. But it's really all about the panels this year, and the panels that I'm really looking forward to looking forward to all of them, but if I had to pin them down, gun to the head, would be the cancer panel on the Friday, and then the do we need to eat plants on the Saturday. Those are the two ones that I'm really looking forward to. So yeah, definitely go check those out.
Yeah, I mean, curious but skeptical people, I think, will probably be, their ears will really prick up with those ones, because it's they're both very understandably sensitive subjects. People have cultural, personal cues for both subjects, really, about eating plants and about what cancer is, how it can be approached, and the kind of false hope and dodgy science that you see elsewhere, which people are, I guess, always worried that they're going to see again. So I'm super excited to see those panels as well. I'm not able to attend this year, unfortunately. It's something that's been in the diary for forever that I really thought about moving, but I can't. But I'll definitely be following up afterwards. And people can do that, can't they? So if they're not able to make it in person, then they'll be able to watch after. Olivia.
Yes, that is going to be an option, as we have all of our talks from all of our previous conferences on our YouTube channel. So it's a great place to go and get excellent information and subscribe to our channel. And so that will be the case this year as well. And those two topics that Sam mentioned, I would also kind of agree with it. Actually, two topics we have never really talked about before as public health collaboration. So that's why it's even more exciting, and to have people like Sophia Clemens coming along, and to have Sean Baker, and also a plant-based doctor who's coming along to have the discussion. And it's going to be great to be able to put that out there for the public, and it will be on YouTube, and people will be able to reconcile these very differing messages that you get as someone who's just standing there thinking, how do I improve my diet? And on the one hand, you've got very vociferous viewpoints about whether plants are the best thing in the world, and then you're also hearing an emerging voice about them not being the case. So we really want to help people try and reconcile those very contrasting viewpoints. And it's never going to give you the whole answer, but it is going to at least help you compare a little bit more easily and go away a little bit more informed, and that's really our intention with it.
I'd be curious to know, that kind of a little peek behind the curtain, as with your consumer strategist hat on, given that eating meat versus eating plants is kind of a controversial topic. Do you see that as like a great opportunity for creating a bit of a debate and a whirlwind and a spectacle? Or do you see it as a bit more of a distraction from working out what the actual truth is, knowing that there's lots of these kind of curious skeptics sitting on the fence, and some of them don't want to see a fight, they just want to see a clear message? What do you think?
Oh, it's all about the clear message. So, and as I said, I don't think we can solve it. I don't think there will be, there isn't definitive science in any direction, and we know that, but at least it will help people understand the information that's out there and how to compare it, because the messages are so different. So it's all about providing that information, having a very informed and not formal debate, but enough back and forth that you can actually dig into some of the issues. So, you know, a lot of the time when we've seen debates online before, and I certainly went through this experience, you'll get a position from one viewpoint, and then you'll get a position from another viewpoint, and then you'll move on to another topic, and then you think, as someone listening in as a layman, what does that then mean? Like, so which one's right? How do I decide? And so we just want to allow for that kind of conversation to be a bit more fluid and open and accessible to people, so that when you're hearing these experts, you're able to have a bit more of a sense of, you know, where does your own opinion lie, because you've been able to bring that information a bit closer together. So it is absolutely not about it being a spectacle, and it won't be, because we're setting it up to be, you know, as informed and structured a session as we can, whilst allowing that back and forth as well.
It's something I've always liked about Dr. David Unwin's work, is that he doesn't want to pick fights with people. He just wants to present his own data about how people are getting better, and he's very careful to do that. And I think that's very effective. Clearly, he's got into the Observer recently, which I think was probably harder than getting into, you know, other papers like the Telegraph or, you know, the Express, or because, you know, the Guardian and the Observer, they might be reticent to recommend a diet with meat in it. You know, there's that. So the fact that his work really speaks for itself, in spite of the fact that he's very careful and softly spoken, and just sticks to the data, is marvelous. And besides like general practice and talking about cancer and talking about meat or plants, what are the other subjects that people will be able to find out about there, Sam?
Yes, so I mean, the morning is all about insulin resistance and type 2 diabetes, which will be with Ben Bickman, Dave Unwin, Roy Taylor, and our very own Helen Gowers, who's the operations manager for the Lifestyle Club. And then later on the Friday, we also have an Alzheimer's panel, which is going to be really interesting. Then on the Saturday morning, we have how to overcome food addiction, which will be another panel, but that'll be started off by Georgia Eade, the world-renowned psychiatrist from the States. So that's going to be really exciting, and kick things off for this year in terms of what we've got going behind the scenes with food addiction. And then later on that morning, we've got Can You Outrun a Bad Diet, with the likes of James Cracknell, Christian Daly, the former Premiership footballer, as well as Victoria Jeffs, who's going to be the oldest woman to row across the Atlantic by herself. So that's gonna, she's doing that on keto as well. So she describes herself as a keto athlete, for instance. That's really inspiring. And then we're rounding off the day after the Do We Need to Eat Plants panel with Are Cows Destroying the Planet panel. So that's a switch, kind of obviously from health and metabolic health over to regenerative farming, but obviously there's a link there. You know, where your food comes from is very important, and kind of as you kind of alluded to with, you know, David being published in the Observer, you know, perhaps they might be reticent to publish David's results in that paper because, yeah, it's omnivorous, for instance, and yeah, there's a large discussion going on in the environmental field in terms of, you know, are cows contributing massively to climate change? And we have on that panel, we have Jane Buxton, who's the author of the great Plant-Based Con, and she did, you know, years and years and years of research into this, and she's got quite a few experts in the field on that panel from the world of farming, and even academia as well in regards to the environment. So that's going to be really cool too.
Yeah, very broad ranging and deep and interesting, and hopefully, gives license for some people to really put their health first. I think sometimes the messaging is that we need to sacrifice our health for some kind of greater good, and I think the more light is shone on this, the clearer it is that that's just not really the way it is. So it's nice to see that that's going to be part of it, and that there's a holistic approach. It was, I was at the Causes of Obesity conference as an attendee in London in October, and there was a really multidisciplinary feel to it. And I think, that cross-pollination brings loads of new ideas and mixing to it. And there's just no, although it's great that the talks are going to be up on YouTube afterwards, there's just no substitute for being there in person and getting to meet all these people. So can you remind us of the dates and how people can get tickets? Olivia, please.
Sure. So it's the 19th and 20th of May, so just a few weeks away now. And yeah, as you said, there's no replacement for being there in person. I myself have been to a couple of conferences recently, and the people that you meet and the networks that you create and the inspiration you come away with are impossible to get online. But we absolutely would love people to watch it online, but please prioritize coming to the conference, because we're a charity and we need the grassroots support, and we won't be able to build this message unless we have that. So if there's something you want to do from a broader societal benefit, then attending is definitely helping us the most, and gives you a really great experience as well. And the way to do that would be to book on our website on phcuk.org/conference. Tickets are available, and there's the option to go for the whole time, the Friday and the Saturday, or you can just come along for one of the days. And either way, it's going to be great. So we really hope people come along and support us.
Fantastic. Yeah, phcuk.org/conference. Get on to the website, get your tickets right now. It's in Sheffield, so it's kind of centrally positioned in the UK. It's very easy to get there. And I would just urge everyone to go on now and buy tickets, and then think about the rest later.
Yeah.
And where
festival as well, so it's a great venue to experience.
Yeah, amazing venue. I've always wanted to go to see the snooker. It's the World Championship snooker venue, isn't it?
Can't promise any snooker though. I'm sorry about that.
All right, brilliant. I really appreciate you both coming on. And I'll personally not be there at the conference, but hopefully that'll spur a few more listeners on to be there themselves. And thanks again.
Well, thank you for having us.
Absolute pleasure, Ali. Thank you.
Thanks for listening or watching, everyone. Please hit subscribe where you're watching or listening so you don't miss out on future episodes. And please leave a review. It takes 30 seconds and really helps get these messages out there. And if you or anyone you know could benefit from a mental health tune-up, head over to metpsy.com. That's metpsy.com, where myself and psychiatrist Dr. Rachel Brown coach people to better mental health.